toxicology test as well
Yes.
when you do an autopsy.
Yes.
What is the purpose of doing a toxicology report?
We do it in all violent deaths, and it's to determine whether there were any drugs or what drugs were in the system.
Was that performed on Gannon Stauch?
Yes.
Was there anything unusual detected in Gannon Stauch at the time of autopsy?
There were some drugs, or there was a drug that was present.
Okay, so let's talk first. Acetaminophen, a typical over-the-counter medication, was that found in Gannon?
Yes.
Would that be anything unusual that a child would have potentially residual acetaminophen at the time of autopsy?
If maybe the the decedent at that time was having a fever or pain, they would give them acetaminophen or Tylenol.
Would that be common, though, in an 11-year-old to find that in a body potentially?
Not, you don't always see that.
Okay. What other things did you find in Gannon's bodily tissues?
He also had hydrocodone in the liver tissue.
All right, so let's talk about hydrocodone. What is hydrocodone?
Hydrocodone is a narcotic analgesic. It's a drug used for pain, and that is also found in cough medications because it's supposed to suppress your cough.
Is hydrocodone a controlled substance?
Yes, you need a prescription for that.
So I can't just go to Walgreens without a prescription and buy hydrocodone?
Yes.
Is it indicated as highly addictive?
Yes, you can be dependent on it.
What are the effects of hydrocodone on a human?
Depending on the dosage, you can initially become drowsy, lightheaded, dizziness, and if you take a higher dose, it could lead to respiratory depression, or you'll have problems breathing. You'll have lethargy, coma, and eventually death.
Was it unusual, in your opinion, to find hydrocodone in a child of 11 years old, like we did here in Gannon's death?
Yes, I found it unusual.
Is that because of all of those issues you just described?
Yes, and if it was for a cough, you would give something that didn't have the, narcotic analgesic in it.
Typically, people would not.
Yes, that wouldn't be the first line of choice.
Okay.